And then
That's why she's packing up. She's ready to go.
Yeah. So nice to meet you, I'm Santiago. I'm one of the co-founders of him. And I want you to think about these words, about diabetes, ischemic heart disease, kidney failure, and cirrhosis. And probably most of these words sound very familiar to you. Because maybe you know someone who has endured this, maybe a family or friend, maybe even yourselves. But maybe something you may not be aware of is that the reason that these words are so popular, so well known, is because these are actually some of the preventable chronic diseases that kill over 25 million people each year. And I think that the keyword here is preventable. Through early detection, diagnosis, or treatment, the complications associated to these conditions can be avoided. But if this is the case, then why are we still losing so much lives? And although this question may have so many answers, today I want to pinpoint the blame on blood testing. Yes, this sounds weird. We know that the diagnostic information we can obtain from blood is unparalleled, but actually, blood testing is one of the biggest funnels for diagnostics because of the amount of pains that it actually represents for patients during their journey through healthcare. And I'm not talking about the evidence discomfort on being poked with a needle, but I'm actually talking about the abundant and burdensome economic, social, geographical, or even bureaucratic barriers that make accessibility so restricted and that even disincentivize people from approaching the healthcare system and approaching testing facilities. This even causes that 46.2% of patients that have a chronic disease actually remain undiagnosed. And this is how HEM is born. We want to democratize healthcare by making blood testing simpler. So our solution is a paper-based parametric assessment test that's compatible with an integral mobile app. It's a self-test that you can use at any place, at any time. And either if you want it for your personal monitoring or to support the telehealth consult you're having, we are aiming to build the simpler way to know, the easiest way to know if there's something wrong with your health. So how does this work? In general terms, you need to pick your finger, you drop some blood on a paper, the paper is going to change color, and boom, you have some data you can send to your doctor. But I'm going to get a little more into detail. The paper is actually, we call it a pad, a paper-related device. And what happens with the pad is that in the center of the pad, we have an agglutinating agent that's going to cluster over red blood cells. So that we have cell plasma separation, and then we can, and this allows the plasma with the analytes that we're going to analyze to fully diffuse to the borders of the paper. On the peripheral regions, we have these four slots. Each slot is impregnated with colorimetric, with color changing reactants that are going to induce a color change in the paper. And the intensity of this color change is going to be proportional to the concentration of the analyte that we can find on the plasma. After we have achieved this color change situation in the paper, we can take the picture and through image processing and computer vision algorithms, what we're going to do is that we are going to extract the regions of the paper that have changed color, and we are going to map this color change, and we're going to pinpoint this color change into a concentration with a pre-established calibration scale. And the end result of this is a user-friendly, a beautiful user-friendly mobile application that's going to lead the patient, it's going to guide the patient throughout all the process of taking the test by himself, and it's going to return some data that the initial assessment on how his blood work is, and some data that he can share with his doctor. If you're a patient, you can see how the user experience working with that would be. You can also use some metrics that is gonna, for example, height, weight, and age, that is gonna be used to calibrate the normal ranges depending on the patient. And this is how we would detect the initial assessment with beautiful colors. You can see if normal is good, which usually is. And here is the data, and you can also have data that you are able to share with your doctor through a telemedicine platform. Now, I am a strong believer that creativity and innovation thrive during crisis. And although this is not an excuse to celebrate COVID, the pandemic did set an perfect timing so that solutions just such as HEM could be viable. For example, on one hand, recurring COVID testing taught patients that they could trust in rapid diagnostic. It taught people that taking a simple preventive test really could have a really positive impact on their medical outcome. On the second hand, with the transition to virtuality, not only was connectivity improved worldwide, but also there was an enhanced growth in telehealth services and telemedicine platforms. Unfortunately, the consequence of this and of the pandemic is that because of the sedentarism that was an unexpected consequence of lockdowns, we have seen a small rise in the prevalence of the chronic conditions that we would like to target and avoid. So, how can we make this idea into a sustainable business? And the approach we would like to take is a B2B2C model. And what this means basically is that we want to, the way that we want to take the solution to people, to patients, is that we want to build upon the system infrastructure, the system distribution channels. And this means going to pharmacies, selling this test to pharmacies, and letting pharmacists sell this to the patients. So you might wonder, why would a patient buy this test? And that's where the other important stakeholder in our business model appears, which is telemedicine platforms. Telemedicine platforms, and more specifically, telemedicine doctors, have the problem that they lack sufficient information to make an informed diagnosis. And maybe some solutions have appeared that they can get some data, some electrical data, some maybe tension and stuff, but there are no solutions for telehealth yet that can provide biological data. And by implementing these solutions, we're giving doctors and telemedicine platforms the opportunity to give a better service at diagnosing their patients remotely. And in this way, by involving telemedicine platforms and pharmacies, we will be creating a health flow of customers between these two stakeholders, and at the same time improving the service that remote patients that under normal conditions need telehealth because they don't live near hospital facilities. They can improve their healthcare as well. On the long run, we would like to work directly with healthcare providers. As you heard earlier, the healthcare system in Colombia covers around 99% of the patients, and in this way, we're pretty much getting these preventive systems to patients massively, and at the same time, we'll be removing the out-of-pocket expenses that would rely on the first stages of the patient. Now, as David commented, this project was born from our senior capstone project. So I would like to tell you a little bit about HEM's journey. So in January 2021, we began with the project. Between January and April, we made all the observation process. We spoke with the stakeholders, and we found the need of making blood testing easier, specifically for people living in rural communities in Colombia. People who, in the majority, don't have near access to a facility where they can get blood work. Between April and October, we worked on the first, we developed the concept. The initial concept was something very similar to the paper test we're working on now, but we're working also on a physical device that had an RGB sensor that was going to measure the color, and the rest would work similarly. Up to October, we made some prototypes. We worked on the proof of concept experience, and that's pretty much where the capstone ended. I think they liked it. And in December, we were accepted as well as to the Start Fellowship Program, which was an accelerator program for startups in Switzerland. Fast forward to 2022, February, we left for the fellowship. And in March, we decided to make the pivot. We took the decision that having an external device was going to be very burdensome, and it's going to be not very practical, because if you develop a new physical device, it's going to be more expensive for patients, and you need to find a way to take it back to the rural communities. So we decided to pivot into something everybody has, which is a cell phone camera. That's why we decided to change the physical electronic device into an application that uses the camera and computer vision to make the assessment of the color. In April, we decided to incorporate as a company in the US, and in June, we issued our first investments, which was 25,000 Swiss francs. Now what's next? Now we're back in Colombia. In a month, we should be beginning with research and development activities. Now we need to make the test real. And we expect within 1 year to be able to obtain a standardized MVP and use a standard MVP, something that we can produce replicably and reliably, to do the initial pilot tests. So we can collect enough data so we can pursue by March 2024 regulatory compliance. So we can start using this in Colombia. Last, this is our team. We're three co-founders, Santiago, Daniel, and Laura. Unfortunately, we are all biomedical engineers, so we are not that multidisciplinary. I'm kidding. Aisha has a different specialty. I know about biomaterials. Daniel knows a lot about artificial intelligence. He's a hacker boy. And Laura knows a lot about microfluidics and bioinformatics. And of course, we wouldn't be here and we wouldn't have achieved so much if it wasn't for trusted board of advisors. Gabriel Castillo, which is a founder of financing platform Doctor, David Dijo, who did some introduction, and Sergei Shevkopias, who is a Russian professor in the US, who holds the patent for paper-based diagnostic tests for blood. We have the knowledge to make this happen, and we're committed to making it happen. We are him, and we envision a world in which nobody has to endure the consequences of a late diagnosis. Thank you very much. If you have any comments, questions, I'd be happy to hear your insights.
No comment, really small. Having seen you both as a jury in your senior capstone project and seeing you today makes me ridiculously proud.
Yeah.
The STAR Fellowship your speech, your presentation, everything is just so beautiful, and the fact that when you finish your capstone project, you were like trying to convince us that your technology was okay, and we all knew it was not developed, so you were like trying to fool us. And now having seen you today, knowing what you have to do is much more encouraging. It's so beautiful. Thank you very much for presenting again. So thank you.
Some Swiss friends too.
I have a question on the, so patients are these patients are going to be able to go to the pharmacy easily?
Yeah, the thing is in Colombia, so Colombia has about 52 million people, but the thing is that most of the population is focused on big cities.
Yeah.
We have really big cities, a few really big cities, and that's kind of one of the big problems with the healthcare system, and it's that the healthcare system is really pinpointed on very specific cities. Just to give you a number, it's a number that we obtained while we were doing our capstone. In Colombia, we have around 1,122 municipalities, so towns and settlements, and all of the healthcare system, all of the healthcare centers are just focused on around 16% of them. So that means that about 84% of the country don't really have coverage that's a coverage in terms of infrastructure. What they do have is that each town does have a pharmacy, and that's why pharmacists in rural Colombia take this predominant position as like the highest medical authority. So people in rural Colombia, when they feel sick, they won't probably go to a medical facility because it's very far away and it's very burdensome, costly, time-consuming to go, but they will probably go to the pharmacy. And if we're able to provide this through the existing channels of pharmacies, and they have a phone, this is a way that they can have access to, it's obviously not gonna have the same quality as rigorous blood work, but it's gonna give them a very good first assessment on how they can be and how
the
they're
fact that these pharmacies are like in really remote areas, there's like already the distribution of, they have to go get their supplies.
Yeah, and that's
the
exactly,
idea.
yeah.
That's why you.
That's the idea. It's hard to build, and exactly because of that, it's very hard to think about building our own distribution channels, and that's why our plan is to leverage on the existing ones.
Can you go
Go ahead.
back to the what you measure on like in the blood, please?
Oh yeah. So initially, we would be aiming to measure these power analytes, which is too many slides, which would be glucose, cholesterol, creatinine, and albumin.
I have no idea what happens in the lab after I order like troponin test,
Okay.
and whatever they do in the lab. So it's a question, and I think it would be great if you added if it could be done. Like think about troponins. We usually ask for when you're looking for myocardial injury, that you
Okay.
have like a test at home that can tell you like their troponins are high, so there's myocardial
Okay.
injury. versus no, chocones are not hard. You know, like you
Okay.
could do it in your house. So it'd be great, okay, maybe you start with this, but think about all the things you can actually like measure.
Yeah, that's actually the plan, and I think that's the beauty of the system, and it's that once we get the know-how on how to implement the systems, we pretty much can find if we can find a colorimetric reagents that reacts with any analyze, we can make a paper that targets that. The reason we want to begin with this, and especially with these four metabolites, is because while talking to many of the doctors that with the many doctors that David very generously introduced us, we targeted that these would be the four most achievable and the four most important. Because with glucose you can monitor diabetes, with cholesterol you can monitor heart disease with the creatinine, you can monitor liver function, and alanine is pretty much an indicator of nutrition. Yeah.
Feel very proud. Well,
Thank you.
yeah, I mean, to the tier. I have two questions. Each person that is in the middle of nowhere. About the phone that this person has, and the quality of the picture, like how does your system age for that? Like how
Yeah, that's actually that's also one of the reasons why we decided to pivot it from a device, from a physical electronic device to the camera. And the advantages of using the camera, and I think it's great that you ask about the quality, is that when we're working with a physical device, we're aiming to have a sensor that would just analyze a pixel, and that would be it. And that pretty much limited that if you got the pixel right, it was going to work, and if you didn't, it wasn't going to work. And the difference of using a camera is that by using a camera, you're not thinking about just one pixel, but you are actually extracting the whole area, and you can use the average intensity of that area to make that assessment. And if you can see here in the images, in the extraction images, you can see that the things that we are analyzing in the paper are not like very well defined, but we're actually just looking for batches of color. So you don't really need really good resolution, because as long as you can identify the batch, it's okay. The other thing about how the system works is that, okay, so maybe one of the big questions that you have on this when you're talking about working from picture is what happens if it's 6 p.m. and what happens if it's 4 p.m. And that's actually the reason why this is the training design of the test. And the reason the test has 4 metabolites and 5 arms is because this is actually a control. I think, yeah, this is actually a control. So this is just plasma. So this serves as a threshold on how normal levels of plasma would look. And the other thing is that, as you can see, the dots that are going to change color are actually in the inner circle. But these color bars are always going to be there. And the reason why we have permanent color bars is because the processing that we are making is not an absolute processing, but actually, and the reason it's near the test is because we take the color that's here, we used the color bars to calibrate the test, to take the picture and take it to what the ideal would be, like get it to a kind of normalize the color distribution to an absolute. And then by this, and then the comparison of the color here is actually done by a notion of similarity between this color bar, because this is the color range that has this reactant. And yeah, by working through those things is how we want to target lighting and how we want to target yeah.
The other question is, so this is, as you said, like people are way, but also can be used, for example, like those groups like doctors with orders when they go really far away, and would this work for those type of scenarios?
Yeah, exactly. The people that we initially, the initial people we used for interviews when we were doing when we were seeking for the needs was the telemetry platform, and this one great influence on how we ended up doing that. But we were also working with a doctor that's called Luis Vergel, which is the director of the Hospital de Barichara. So it's a rural hospital, and because of the lack of hospitals, they make a monthly, it's called like medical missions. So they basically take an ambulance and they do a trip around the municipality. If they see something wrong, they tell the people to go to the hospital. Mostly they don't do. But one thing that he liked about this solution, or that that inspired this solution, is that by having this, you could have like a stack of portable tests, and just by going around and looking at the patients, you can have a portable way to take rapid tests of blood.
What's the IP situation?
The IP situation, it's quite funny because we were working on this, and when we got to Switzerland to Sortology, a random guy just asked us like, "Have you checked out the IP?" And we had checked the IP, but we hadn't seen much.
He's your advisor now?
And yeah, that's the thing. So we started looking, and we found a patent that described exactly what we want to do. Well, not exactly, but around like 98% of what we want to do. And we felt like everything was crumbling apart because, yeah, obviously we can't do this if we don't own the IP. But we started looking, and we saw his profile, and we just decided to send him an email. He responded. We had a meeting with him. We explained to him the idea, and he was really happy about the idea. He was really happy about the idea because when he developed his patents, or his project and his patents, he did it as a non-profit project. But as soon as the funds ran out, the project died because they had no money to continue implementing it. They were implemented in Africa. And what he most liked about this was that he saw that the technology was feasible because he worked on it, but that we had a very promising business model, and that we were actually finding a way how we could make this sustainable and long term. And yeah, on the long run, what we want is the only way you can make this solution work for people is if you can make it sustainable and available. So we talked to him. He is the inventor of the patent. He is not the owner of the patent. The owner of the patent is the University of Spain, which he no longer works on. So it was a whole other deal, contacting the university and speaking with them, and especially they had a patent with the World Intellectual Property Organization. So we needed to license it because World Intellectual Property Organization all was covered, and it was a huge deal because it was like 2 months us like thinking about how we're gonna license the patent, how we're gonna make the deal. And at the end, we had a deal with them. We had the meeting with them, and they withdrew their application for the World Intellectual Property Organization. So there's actually no patent in Colombia. So they after we pitched them, they said they really loved the project. They were really happy that something that came out of the university was actually turning into something good for the world. And they were happy with the project and told us that we were free to use this technology in Latin America. So that's the intellectual property situation for us right now.
So you won't go to the US with it?
Yeah, probably. We want to start in Colombia, then expand to near Latin America, and then probably we are going to go to the US or Europe. But by that time, we can license it when we go to when we go back to the US.
Nicest IP story I've ever heard.
I know. I thought you never get hired. Attitude of the tech transfer office. So congratulations, really amazing presentation, great story, great pitch, great analysis of the go-to-market strategy. I thought it was really good work. One thing I think would be, so the questions I have are mainly around the technical.
Yes.
Everything else makes rock solid, good sense. Very well stated. So from the technical side, a couple of things. One is, it would be nice to upfront to articulate some need specification.
Okay.
So you're saying that you said that if somebody gets a screening, then they go to the clinic and they get some blood draw, then they get the IV accurate test done later. So this device is designed to give them an indication something is wrong. So then they can go and get the full accurate workup. But that word accuracy does not appear early on in the specification. So it'd be nice to know that in order for your product to be useful as a screening tool, how accurate does the glucose measurement have to be? How accurate does of course, it doesn't have to be as accurate as the lab test, but even in the role as a screening tool, it would be good to know, based on your interviews with people, etc. Because this is not a technical question, it's also a question of false positives, false negatives. For example, we've heard in some years that there's something wrong and they have to make a trip from a rural area to a city, and it turns out there's nothing wrong, then they just wasted a day of labor and some bus fare or whatever. So this tells how accurate the test actually is.
Yeah, yes.
My question is different. It's the mirror image of that in design. Is how accurate does it need to be? in order to bring the value that you think it will bring. So if you say the value of our product is that when a person in rural Colombia can go to the pharmacy, get this piece of paper, put a drop of blood on, take a picture with their phone, and get some early warning that something is wrong. How accurate, so that's very valuable. That's an incredibly powerful story. The question is, how accurate does the glucose measurement, it's going to be different for each of these tests, right?
Yes, of course.
So that's the question that is important. Because I have no doubt that you can make something, yeah.
Yeah, the reason I was opening this slide is because the FDA actually released some guidelines on how this specifically glucose monitoring systems should work, or at least which are the ranges, and the range that this system should comply with is plus or less 20%. And what we found from peer-reviewed research, in which we're working based on our work, is that we can obtain up to 13% plus 13%.
Perfect.
But one thing I really like about this work is that this paper, in which we found this beautiful number, is that this paper doesn't use any sophisticated way to analyze the test. They just take the color test and they scan it by using computer vision algorithms, and we can use many other elements to try to reduce that
Perfect, wonderful.
errors.
I think this is gold. And if you had the same kind of, this is what the requirement is, and this is what a pad can do for all 4 of those tests, it would be very compelling.
Yes, that's the idea.
Yeah.
Do you remember on like, I think because Lynn had a slide, or someone had a slide that was just that. Like, here's what my solution's gonna have to be to be successful.
Yeah.
And then you're like, and ta-da, look,
Yeah.
this is a good answer to that.
So that's the needs specification table where it says, in order for our product to deliver the value which we think it can bring, it has to have glucose within 20%. It has to have creatinine within 5%, whatever it is. I don't know what the numbers actually are. And that change differs whether you're talking about screening versus actual, definitive
Yes,
diagnosis.
of course. Yeah.
Very different. And because it has to do with the financial aspects of false positives and false negatives as well as the medical aspect. So I think that would be an important component. It'd also be good to make a table kind of like the other table that was made about the competitive landscape.
No, we actually had that different presentation, but actually I made this specific presentation a little bit more technical oriented,
I see.
because we were in Switzerland. They don't really care about the technical part. They just like the beautiful numbers. So I kind of got rid of that because I want to show you a little bit about the science
Wonderful.
rather than the competitive advantage.
But the competitive advantage will say things like what other paper-based strip, or lateral flow assay tests are available for these 4 things.
Yes.
And is there some advantage to putting them all 4 onto one test? So 1 drop of blood could be gone and put it on 4.
Mhm.
So that you have to somehow justify the value of putting it on 1. So another thing is just a little slight technical thing. If you bring up the picture you had of the device, the paper.
Of the design, the current design.
Yeah, so I have a little bit of yeah. So, you have a marker for the whiteboard?
Angie.
Wow. Okay, let me suggest something to you. So, one of the things I noticed is that this is rotationally symmetric.
Yes.
So if you take a picture with your phone and you're holding this angle, or you're holding this angle, because it's identical rotationally, you can't tell the difference.
No, actually, the paper is square. So
It's square.
it's square, and
Okay, then 90 degree off. You won't see, okay, so.
no, so actually, because the inside is a pentagon or a 5-arm structure,
Yeah.
and the paper is square, it's unambiguous, and that's kind of
It's
the
unambiguous if I rotate like this?
yeah,
Because the 5th arm.
yeah, because the 5th arm is parallel to the bottom,
Ah, okay.
and
But
we
the
actually
original picture, one
and-
of the pictures didn't have a 5th arm.
No, yeah, because that was a, that was,
The original.
it was a, yeah, it was the
So you're
pre-design.
saying that I can tell any sort, it's totally unambiguous. It's
Yeah.
not symmetric in any direction. in this
It's not symmetric, no, because of the corners and the interaction of the polygons. This was the previous design, and
so that
that was actually a problem that we faced when we were doing the pattern recognition in order to make the mask. It's more the extraction of the parent.
Okay.
And that's actually, we also wanted to introduce the control arm, but we actually made that design to get rid of this ambiguity.
I was gonna suggest something, if you go back to your image.
Yeah, sure.
You could just, like make these different shapes, like.
Yeah.
Different hairstyles.
You know, for different things, different ones, so they don't have to all be the same shape, that was totally your decision to make it look pretty. Or maybe that's, you know, how you can draw in CAD, you know, that's,
Yeah.
yes. But actually, when you're printing this, you can make them all sorts of different shapes.
Circles.
Yeah, circles or, you know, triangles,
Okay.
just so that there'll be no ambiguity about the rotation.
Okay, yeah, thank you for this.
Yeah, but how does the control work in terms of illumination?
So the illumination is, I actually got distracted earlier and I got into the wrong discussion, but the illumination is actually only fixed by this color bars. The control, what it is a slot that doesn't have a color reactant, so it's just the pure color of plasma. So by having the pure color of plasma, we can have a reference on what the, I don't know, the zero level of color should be, something that we can subtract to make other kinds of analysis to reduce the error, or maybe, and something that we are also thinking is that maybe if the blood extraction by some reason is very abrasive, maybe it's gonna come very red, the plasma, because the red will be punctured. And in that case, maybe the test would automatically be wrong. And it's like a control tool that we can use either to improve the analysis of the other test, or just as a general notion that the test is working properly, or if the test was made properly.
Yes. So you thought.
Yeah, absolutely. You can keep it.
Now we're gonna hear from.
Oh, thank you.
Yes.
Good job.
Who of the two of you wants to go first?
Making you sit there.
Ya estás listo.
Sí, yes.
Ya puedes ver el compartido.
I see.
Y te recibo.
How long is this